we're actually going to start with you. And this question is going to be the same question for everybody on the panel when we work around. What does PACT physical therapy mean to you as somebody who receives care?
Honestly, I wouldn't know how to answer that question unless I had experienced something with my hero in the Hero Clinic. Thank you. There's a history there. But when there was a my wife and I enjoy walking every morning 2 to 3 miles, and there was a time within the last year when that stopped. And I did something to one of my ankles. I couldn't figure it out. You know, you go to WebMD, all that kind of stuff, and nope, couldn't figure it out. Couldn't do anything on my own. And I think I came in as a walk-in. And of course, with his normal aplomb and everything that he could explain to me, he told me exactly what my problem was. And then he said, by the way, a door or two away from us is Jasmine. And instead of saying in 2 or 3 weeks we're going to send you to PT and get this taken care of, which is the norm. And by the way, I love my VA. I love every doctor. Seriously, every doctor that I've had here has been much more expeditious than outside. But I knew that PT meant several, waiting periods down the way. I hobbled, he walked, down a little hallway, knocked on the door. She was there. I think you might have called her first. And she said, oh, yes, come in. Said goodbye to Dr. Sandoval, and she took care of me that day. That day, I knew exactly what I needed to do to take care of the next 2 or 3 days with my ankle so my wife and I could go back to walking. And so what it meant to me experientially was I had immediate care. I didn't have to go through a lot of, she gave me some gadgets or ice or whatever to be able to deal with that situation. But I knew immediately what I needed to do to be able to go back into my routine with my wife. And then, can I give a second illustration? I don't know my time. My time is up. About, what's it been, 3-4 weeks ago, when I was in Africa, I'll try to make this short. When I was in Africa 45 years ago, I tore my ACL. A year and a half later, I couldn't come back for a while. A year and a half later, I came back, had it operated on. They did a great job in Denver, where there's all the ski wannabe people. There's great doctors over there, so they knew exactly what to do. 98% movement was tremendous. So for 40 years, it served me well. Finally, through the arthritis and everything, it was gone. So I came in and I said to Dr. Sandoval, I'm not sure what to do. I know I had to go to orthopedics. And I just was not, our walking routine was gone again. I could not walk on my left leg. And I knew that something was, I knew the meniscus was gone and all that stuff. I understood that. Dr. Sandoval said, hey, and I said, yeah, I know, okay, she's around the corner. I couldn't make it around the corner. In fact, in the hallway, I collapsed. And he took me under his shoulder and walked me around the corner to Jasmine's room. But it was that immediate, efficient care that really made the difference. It wasn't, okay, let's see if we can put you on the roll for help on the 3rd floor in a couple weeks. So to me, I had that experience twice.
Very good. Dr. Sandoval, what does PACT-PT mean to you as a physician?
I think the best thing you said to kind of put it all in a bundle was the, oh, by the way, which is what I love to insert in the conversation, trying to bring in physical therapy. As a physician, I had already kind of a plan when you presented to me. We had talked on secure message. So I had prepared my nurse. She was expecting you. And I already had a 1-2 step in my head about what I was going to do with you. And I had a degree of expectation, but then as I met you, I realized how severe, how limiting this was to your day-to-day. And by the way, I have physical therapy in the grounds. So before you checked in, I had alerted Jasmine, say, hey, I have a patient coming in today with this, this, and that. He told me on secure message, and he's here already. Will you be able to see him? And the answer was, send him over. All right, you were in the triage room. I had already ordered your film. I had some medications prepared. And I just presented the case to Jasmine with what I thought was my initial perception of what was going on. And having her and having Jeff back there, who's always, he's my PM afternoon physical therapist. Jasmine is my morning. It's a symbiotic relationship. Sometimes, many times, they add more to the case. They will guide me into what else I could order or what it could also be. Because we as physicians, we have, as you're talking to us, I tend to kind of start labeling quickly 1, 2, 3, 4, 5 of the potential possibilities this could be, because I had to formulate a plan. But in that process, we could get boxed into thinking what we think it is. But it is amazing to have two experts available who deal with this and only this every day, every week, every month, who also work with orthopedic surgeons, who know these joints, these backs, a little bit better than I.
Patients that show up to our clinic with any kind of muscle or joint pain, I would probably say that 60 to 70% of them say, I want a consult to orthopedics. All of them. My question to them is, do you want surgery? Well, no. I said, well, I have a musculoskeletal specialist right here that doesn't do surgery. I'm going to have you see them first. Oh, in addition to that, again, being an academic clinic, I see so many residents' notes in their physical exam on their shoulder and their knee. It says, decreased range of motion. Where's your physical exam at? So I then contact Dr. Diaz, and what they can do is they can educate the residents on how to do a specific physical exam and how to document it, because that's on boards. And so it's a huge benefit to have a musculoskeletal specialist there for us and to teach the residents, the young learners. So yeah, being in a packed academic clinic, PT is invaluable.
In a nursing perspective, it's a game changer. I deal with veterans very, very frequently, a whole lot more, with all due respect to the providers, much more frequently than they do. Probably 50% more. I probably speak to them 4 or 5 times more in a day than a provider does. Whether it be 5, 6 times through secure messaging, trying to resolve an issue. They're having this aches, this pain, this, that, and the other. They want to be seen for this, they want to be seen for that. Just recently, I had a veteran who's been going back and forth trying to get into pain management for back pain. I had spoke with Jeff, thank you very much again, set up a game plan for the patient to come in. Jeff's like, yeah, bring him in. I'll get him. I'll come see him. We'll work something out. Game changer of getting him some independence back, get him set up with treatment, and that actually satisfied the patient, got him some independence back, as well as moved him along in his treatment plan to get him into seeing pain management. Game changer for the patient, for staff, for everybody. Game changer. It's the best thing that I've seen come into primary care. And I've been doing primary care in the VA for over 10 years now. Game changer is the best word I can say with physical therapy on board. Hands down, game changer.
So they've said it all. So what PAC physical therapy means to me is obviously a lot of professional satisfaction. I've been a physical therapist, as I mentioned, for about 17 years. And I'm sure that for those of us that have been around, you can feel the burnout. And I do feel like being in this role has allowed me to be stimulated in a different way. And it has allowed me to grow as a clinician in a different way, because not only do I work with a multidisciplinary team, but I have yet to see a veteran disappointed in this service.
So it's like from working in series to working in parallel. Very quickly we get a lot of stuff done. And in an hour's time, you have offered the level of care and outcome that will take about 3 to 4 weeks in another scenario or in the private sector. I worked in the private sector, and this is unmatched. You don't get this done anywhere else like this.
You've been working with this one team. If you were to get embedded, not embedded, if you moved to another PAC team or even another facility that did not have physical therapy embedded, what would be your messaging up the nursing chain of command to help facilitate that, as well as with your new PACT that you'd be working with?
Simple. It's a must-have. It's absolutely a must-have. And I can speak from my own personal experience of actually being injured in the military and not receiving that immediate response as far as getting that care. And then also being injured in the past and having to wait for that delayed care to happen. I see the quick turnaround in patient care. I see the quick response in the improvement in the patient. It's imperative to get that patient back on track as soon as possible. And with you having physical therapy right there as soon as possible, it's just imperative to get it going as soon as possible.